All right. Hi, good day, everyone. So, our group will be presenting on cognitive therapy. The presenters are as follows: myself, Nadimi, Travern, and Yobo. To start things off, we wanted to open with a little opening quotes, a little funny quote, right? Therapy can be a good thing. It can be quite therapeutic, and this was taken from Alex Rodriguez. So in this first section, under description of cognitive therapy group, we are going to be discussing what is cognitive therapy, description of cognitive group therapy, how was it originally created, who were the originators of this type of group, and what is the therapeutic purpose of cognitive therapy. All right, so first we ask, what is cognitive therapy? Cognitive therapy was one of the first psychotherapy that was clinically tested and validated by experimental research. Cognitive therapy is used often by counselors to help understand the behavior, emotion, and thought of a client in order to know how to treat the client. The client and counselor both work in a collaborative effort to understand and correct the maladaptive thoughts and behavior. It must also be noted that cognitive therapy falls under the umbrella of CBT, otherwise known as cognitive behavioral therapy, right? It is Cognitive therapy can be considered a component or element of cognitive behavioral therapy. For the description of cognitive group therapy, we decided to divide it as in group therapy and also cognitive group therapy. So, group therapy is a space where persons work on their individual issues but within a group setting. It helps reduce their isolations and feelings of being uncomfortable. For the purpose of this assignment, our group decided to delve further into cognitive group therapy, and this centers around changing a person's distorted or negative way of thinking, or otherwise known as illogical thinking errors. In other words, it attempts to restructure the beliefs a person has that leads to negative or harmful behaviors. It achieves this by utilizing group, rational, cognitive, and behavioral procedures. For example, cognitive behavioral groups that focus on substance use disorder begin by identifying situations and environment that trigger addictive behavior. What this allows is that the therapist and the group members have an understanding of the thoughts and feelings behind their need for substance use. I'll be passing on to my colleague Trevor.
Thank you. So now we are going to go into how was cognitive therapy originally created. The idea for this type of therapy was created by Aaron Beck. He noticed that quite a few of his patients had inner monologues and that is talking to oneself, and these inner monologues impacted their feelings. He deemed the emotionally loaded thoughts as automatic thoughts, and sometimes you may see automatic negative thoughts. Continuing, he saw that persons had distorted views of themselves, of others, and of their future. And these views should be challenged in order to decrease mental health issues such as anxiety and depression. He believed that therapists and counselors should try to reveal the faulty thought patterns of clients and help them to challenge them. And then eventually they would gradually cause change in their thinking processes. Who were the originators of cognitive therapy groups? So, as mentioned before, cognitive therapy was created by Aaron Beck. So, by extension, this type of group was also created by him in the 1960s. Moving on to what is the therapeutic purpose of the group. Cognitive therapy groups can be utilized to treat a number of issues such as mental health issues like depression, PTSD, different anxiety disorders, and phobias, etc. It is also used for other non-mental health issues like grief and loss, chronic illnesses, anger management, domestic violence, and more. Cognitive group therapy is an approach to group therapy involving the use of cognitive and behavioral processes of persons within a group setting, though, in order to improve the coping skills of the members of the group. This therapy group focuses on reforming the intrapersonal issues experienced by persons. Also, the purpose of this group is to help persons to deal with overwhelming detrimental problems or behaviors in a more healthy and holistic way by taking things in small steps or by breaking them down. It emphasizes the importance of improving persons' reasoning, encouraging rational thought rather than irrational or illogical thoughts, and improving responses to certain situations. So now I'll pass you on to Yobel, who will be doing the other section.
Thank you, Trevor. For my section, we'll be dealing with the components of cognitive theory, where we will be discussing the clinical application of the group and the time frame. The clinical application of cognitive theory has many different subsections or parts to it. Active. The client's therapeutic process, as this process centers around their action, thoughts, and emotions. Essentially, this means that the clients take center and front stage throughout the entirety of the therapeutic process. Motivational, it is the therapist's duty as a change agent to help motivate the client from negative behavior to a positive thought or behavior. Directive. The therapist must be able to All right, sorry about that, guys. Back with directive. It speaks to where the therapist must be able to set up a treatment plan or activities to help the client contribute and aid in their change. Structured, the therapy has assigned steps of procedure to follow to arrive at the treatment plan, beginning, middle, and end. Collaborative. The clients and the therapists have to be able to work together to arrive at desired outcomes. This desired outcome being the change behavior or thoughts. More so the client determination goes a long way in this process. The therapist must have an accurate assessment and understanding of the problem at hand in order to assist the clients to form treatment plans in order to evaluate their progress. Solution focused, the therapist works with the clients to identify presenting problems to generate solutions. Time frame. The time frame can be both long or short. It is mostly for the short term. Long-term time frame only occurs if the client suffer from severe depression or some other severe mental illness. The session usually lasts for 30 to 60 minutes once a week for a duration of 5 to 20 weeks or sessions. One session per week, 5 to 20 sessions or more. We will now have a demonstration of the cognitive therapy group in action, where in the form of a skit, where the skit also follows the assigned steps of procedure as if it was an actual cognitive theory group operation being conducted, where it has a beginning, middle, and end.
All right. Okay, so good afternoon, everyone.
Good afternoon.
Good day.
Alright. So welcome to session one of group therapy on anxiety. Right, my name is Nadimi, and I would like to get us acquainted with one another. But before we begin any formalities, I just want to make it clear that anything that is happening here today or mentioned here today is remaining confidential. Okay.
All
All
right, no
right.
problem.
Okay, great. So could you guys tell us your names, first name basis, age if you would like to or feel comfortable, and what brought you to therapy?
All right, I will go first. My name is Yovel, and I'm 21 years of age. I personally, to be honest, did not want to be here. I really don't like group settings and being around too much people. But my parents saw that this session would be very beneficial for me because they think that my anxiety is getting worse. So in order to put their mind and probably my mind at ease somewhat unconsciously, I guess. Um, you know, I agree with their uh recommendation of joining this session.
Okay, well, hi, Yuval. And I understand, and I'm glad that you came, and I hope that you could leave the session feeling much better than you originally came in.
Thank you. I really do hope so as well.
Okay, so who's next?
Hi, I'm Trevin. I'm 21 years old, and well, I've always been an anxious, kind of careful person, but I find recently it just getting real out of hand. I feel extremely anxious and overwhelmed, and sometimes it affects school, sometimes it affects daily life, and it's just really, really stressful. It's very frustrating and tiring and draining. So that's why I came here today. I'm just tired of fighting with my own thoughts every day.
Okay, well, hi, Chaplain. And I understand it must be very difficult. And I commend you for taking the steps in improving your situation by being here today. All right. So, guys, as I mentioned before, everything that we discuss here and everything that is shared here is completely confidential. Right. This is an open group, though. So if anyone wants to say anything or share anything, and you hear anything that you can relate to in any way, feel free to chime in, give your opinions or your feelings, but make sure it is to be done in a respectful manner. Is that okay?
Yeah.
Yeah.
Okay. So great. So let's get started. I would like to firstly find out from anyone, what are the thoughts that first run through your mind when you are put in a anxious inducing situation?
Well, I'll go. I have an example that's recent, like last week. I had a midterm quiz for school, and I studied so hard for this quiz, and I really thought I would do great. Like I felt like I would do so good. And when the results came back, I barely passed, and I just felt really sad because I started to think, well, if I barely pass this one, then I might fail all the others, and I might even fail my final exams. And if I fail my final exams, I'll have to repeat my courses, and nobody have money for that. My parents can't afford that. I don't even have a job, and I don't know. I thought about maybe I shouldn't even be doing this degree. Maybe I'm not even smart enough because I might just not get a degree at all. It's just, it was just a struggle. My thoughts only spiraled from there, and I felt overwhelmed for the entire week.
Okay. It sounds like your thoughts have a domino effect, really and truly.
Yes, it just gets worse and worse, and I spend time worrying and stressing instead of studying or relaxing.
Yeah, it's a similar situation for me because I feel a course last semester and every single semester after that, I felt like it was going to be the same. Where I'll feel everything and I'll be able to get my degree. I'll bring shame to my family. My parents will definitely disown me. And everybody who knew that I feel the degree and the courses will think that I'm stupid. So that's why I really don't socialize much, if any. I feel like people are judging me. And I rather feel stupid in private rather than stupid in a public setting. and then coupled with all of that, this COVID-19 pandemic still going on. So that's another reason to feel anxious around other people, and I suffer with sinus issues. So everybody starts judging me if I sniffle or sneeze too much, or if I say I can't breathe properly, So in order to avoid all that confusion and mess, I'd rather just stay at home.
Okay. Well, I understand. But what I'm basically gathering is that you guys have continuous negative thought patterns about school, and for you is with anxiety surrounding COVID as well too. So your experiences before would have created like a fear and anxiety that just continues on.
Yeah.
Basically.
Okay, all right. So in therapy, we call these thoughts automatic thoughts. These are thoughts that becomes very emotionally overwhelmed you and cause you to feel very stressed and anxious. To deal with this, we must identify the first negative thought that we have and stem where it originally came from. So for travel, your first automatic thought was, I'm going to fail all my other quizzes. And it stemmed from the one low grade that you got from one quiz. We must consider how you can feel better about this grade so that your other grades does not resemble this one. And
Mm.
after seeing your quiz grade, wanting to ensure that the other marks are better, what do you think should have been your original first thought?
Can I answer?
Sure, of course, this is an open environment.
All right. Well, I struggle with this as well, so I'll just be kind of answering for both of us, I guess. But I guess she should have or can find out why the grade for that particular course was so low, and then from find out why it was so low, work on the areas that need improving or improvement.
And that's correct. If we train our minds to find solutions instead of worrying and causing a domino effect of automatic thoughts or these negative thoughts, we will spend more time preventing a reoccurrence. But what we tend to do is use emotional reasoning rather than factual reasoning. We go solely based on emotions and not logic or facts of the situation to affect change.
I understand, but sometimes the first thought just comes with so much. It's not just the thought, it's the thought and then the feeling. Sometimes you can't even breathe properly depending on the situation. Like how you supposed to, I don't know.
Yeah, me too. I get very nervous, then I can't think straight, and then my stomach hurts, and it's become very difficult to focus on anything else after that. So how is it possible to, change our thoughts in that circumstance?
All right. Well, firstly, we need to keep track of how we feel in certain situation and the thoughts that accompany those feelings. So once you are able to identify these feelings, you must make a conscious decision to change these thoughts into something positive. Right? Instead of letting these thoughts and feelings change everything, you should acknowledge them and figure out what to do to change them.
It sounds very easy and
Mm.
simple when you say it, but I know from experience that, it is very much the opposite.
Yeah, it is. I agree. It is not going to be easy, even though we wish it would be. However, everything takes time. So you must not pressure yourself to change all of these thoughts too quickly, because it is important that you take all the time fully to understand the thoughts that you have and when you have them and the entire process. What do you think about it?
Um, well, I'm willing to try because it's really frustrating not even understanding my own thoughts and stuff sometimes. So maybe it will help. I don't know. I'm willing to try.
Yeah, same here. I mean, I guess I could try to see if it improves my situation because at the end of the day, I really have nothing else much to lose. So,
Okay, well, great. So, having discussed all of this, do you all think that there's anything you want to mention or anything that you feel we should have touched on?
no, nothing from me. I think we touched on everything.
Yeah, I don't have anything.
All right. So, what are your thoughts after the session? Do you feel any different than when we first started off?
Well, for me personally, I feel less alone and isolated because I realize that it's not just me who, suffers from this condition or this or goes through these experiences.
Yeah, it's same for me. I always feel like I'm alone, I'm isolated, like nobody, it's just me that go through this. So it's a little comforting to know that other people go through the same thing that I go through.
Okay, well, it's good to hear that you all feel a little bit more comfortable, right? Well, that brings us to the close of this session. If there won't be anything else, no? All right. We will get more into our next session next week. So remember, be aware of these automatic negative thoughts and the feelings around them. So let's try to challenge them this week. All right?
All right.
Okay. All right, and that was our full presentation and breakdown of cognitive group therapy. Thank you for listening.